Lifestyle, as I'm joined by, of course, the chairperson of the People Who Use Drugs, which is in the Western Cape, the one and the only Natalie Jacobs, as we're talking all things Closing the Gap campaign. And she joins me right here. Hi, Natalie. How are you?
I'm fine, Rata, and yourself?
I'm doing amazing. It's so good to see you. Like I always say, that it's always good reconnecting, and most importantly, just celebrating the work that you're doing, because it's quite important work, especially in our community. So let me let the record so people understand exactly why this work is so important and this conversation is so important. Now, with the aim of ensuring South Africa meets the ambitious UN AIDS 95-95-95 targets, which is making sure that 95% of people living with HIV know their status, are on treatment, and those that are on treatment have a suppressed viral load. The People Who Use Drugs sector, established by the South African National AIDS Council, is championing for people who use drugs who face significant barriers when trying to access healthcare services, often due to discrimination and even stigma, through their Closing the Gap campaign, reminding us that the only thing tragedy gives us is the opportunity to rebuild our lives. Now, first and foremost, Natalie, before we get into the crux of the conversation, for someone who's hearing about your organization for the first time, please just unpack the work that you do and the interesting conversations that this has opened you up to, especially regarding, some of the biggest misconceptions that people, are hearing when they hear about your organization.
Okay, so the PWUD sector, People Who Use Drugs sector, is a sector where voices come together to raise our voices where PWUD community are concerned against stigma and discrimination, and also to join hand in hand just to face the significant barriers when trying to access healthcare services. And that is also due to discrimination and stigma, making it important that than ever to ensure their voices are heard and their needs are being met. The PWUD sector was established through SANAC, the South African National AIDS Council, as well was formed to do just that, bring the voices of people who use drugs to the forefront and of discussions about healthcare access and HIV prevention.
I love the fact that you mentioned that, because tomorrow, with it being International Day Against Drug Use and Illicit Drug Trafficking, what conversations do you hope we have more of to close that gap, especially when we witness the realities of drug abuse in our communities? What conversations do you hope we have more of?
So basically, it is topics like stigma awareness campaigns, awareness around HIV, the risk and the prevention of HIV, as well as where people use drugs, especially ones that inject drugs, on how to inject safely by going to the TB HIV Care, which are the organization that does the harm reduction packs, where clean sterile needles is distributed to our community, and that is to prevent HIV, STIs, hepatitis, any blood-borne diseases. So basically, it is some of the community things that we are trying to promote substance use, but we are trying to prevent the spread of the viruses.
Definitely. And of course, this is also where, that you are, that PWUD sector is helping South Africa reach that UN AIDS 95-95-95 target. So please just unpack the initiative of Close the Gap. What does it look like? And most importantly, what does it mean for people who actually use drugs?
Okay, so basically it is the 1.1 million Close the Gap was the initiative from the National Department of Health, as well as SANAC, which is the South African National AIDS Council, and the civil society organizations, which is in the Western Cape and in different other provinces. So basically what we are trying to do with this campaign aims to ensure that South Africa meets the ambitions of the 95-95. So 95 know your status, 95 on treatment, and 95 survival pressed. You equals you, undetectable, untransmittable. So, and through this we had discussions. So in the Western Cape, the Western Cape was the last province to host the 1.1 million gap. So our aim is to reach the people, the community, that, and to put them on treatment, and as well as it disperse people that defaulted on the treatment to get them back on treatment. And also we are talking about in the rural areas as well, to get people also on treatment, because it's very difficult going to a clinic that is like in another area, and also that just the lack of services that's in the rural areas. It just people don't have that transportation, that capacity to get there, to get the treatment in. So we are trying to get treatment where people are at.
Okay, so it's about going to the people as opposed to the people coming to you. Whew, as we say that you cannot defeat darkness by keeping it caged, so let us be the change that we see in the world, and that starts with not only restoring that dignity but having these conversations. I definitely know that a lot of us want to be part of that change, but it all starts with coming through to these conversations. So we are inviting you into this conversation. Hit us up on our WhatsApp line on 061-862-1065, and you can definitely call us on our studio line. But of course, if you've just tuned in, we are speaking to the chairperson of the People Who Use Drugs organization, which is all about leading the way in closing the gap, which is an amazing campaign in order to make sure that 95% of people living with HIV, they know their status, they are on treatment, and those that are on treatment have a suppressed viral load. So of course we are inviting you into the conversation. Now, of course, coming back, Natalie, with regards to, making sure that you guys go to the people, with a lot of people still unable to access or even stay on those treatment, what are some of the challenges that they face, particularly those who use drugs, when they're trying to access these HIV and TB services, and in what ways does this also hinder their chances of actually getting the help they need?
Okay, so basically most of it, why most of our PWUD community members are not accessing services is due to the stigma and the discrimination at healthcare facilities. Basically, it is healthcare facilities. You have to have a physical address in order for you to open up a folder, and also you get that judgmental looks from the staff, and but we are trying to do sensitization trainings in order for the clinical staff to how to approach and how to treat people who use drugs, because at the end of the day they are also human, and also they also need the services that are provided for people who don't use drugs.
And of course, then what is then, I'd like to ask it like this, as you say that, there's that stigma that comes in with, someone coming through needing help, and unfortunately they don't end up getting the help because they feel like they're ostracized from the community that they are currently living in. I want to know then what then goes into actually accessing those testing stations, particularly HIV and testing in Cape Town, especially for someone who is using drugs, and most importantly, what then happens when they aren't able to access it? Where do they go? What happens to them?
Okay, so basically what are we trying to do, it is especially myself working as a community linkage officer as well with the PWUD sector. I try to link people mostly to care, to healthcare. So what I do is I assist, I support, and I go with the client, and I make sure that they do get initiated onto the treatment, going for the testing, going for screening, whichever health issue they need to be that needs to be attended to, I will make sure I will sit there and to make sure that they are getting onto the treatment.
And that also speaks to the organizations that are part of this, because it's not just PWUD, but it's also other organizations that are helping to improve that access to healthcare. So please just talk to us about some of the work that you're doing, and what are some of the conversations that you're having, because like you said, that there's that desensitizing of the healthcare workers and even the community at large to make sure that people feel seen and are given that grace. So what are some of the organizations doing in order to make sure that access is available for every single person?
Like I said, basically, we in partnership with TB HIV Care, which is a organization that also is part of the PWUD sector program, and also initiates people who inject drugs onto the methadone program, which is the opiate substitution therapy program. And they also do testing as well, but they do referrals. Once you test positive, they do a referral to a clinic for you to get your treatment. So we are trying to make sure just that access to services for PWUD community is available, affordable, accessible, and that people who are against that it will be held accountable.
Definitely.
Because at the end of the day, I make an example, at the end of the day, you don't want your daughter or your son to be involved with somebody that is using, injecting, and are not using safely.
And that also comes with, the harm reduction packs.
Yes.
What role do those packs play in keeping someone healthy? And most importantly, why is it so important for them to actually not even share needles? Because that's another thing that also, spreads the HIV virus.
Definitely.
So please do unpack that for us.
So the harm reduction packs contains of sterile needles, your alcohol swabs, your water, so basically it is a whole pack that you can use when you inject, and that prevents you from spreading the diseases of HIV, hepatitis, STIs to a next person without sharing. So if you share with somebody else, not knowing the person's status, you are at risk of contract.
No, of course, Natalie, I'll be honest and say that a lot of people might be listening to the conversation right now and also be like, but doesn't that mean that you are kind of promoting the use of drug abuse? How then do we start breaking that stigma and saying that we just want our people to be safe?
Yeah, so basically it is, the thing is this, our society does not see substance use as a criminal offense, but as a public health risk. So in order for us to work together and to make sure that each one of us individuals are accessing services, we have to have an open mind as well. You must think of why that person is doing drugs. It can be trauma, it can be gender-based violence, that person could have been raped, domestic violence in the house. Many stuff can lead for a person to start using drugs. But before that person used drugs, he was a normal person like you. And don't judge. Support where you can, but you don't have to spoil that person, but have that support, have that empathy, that compassion for the next person. Because at the end of the day, you have to think for yourself also, it could have been you also in that person's shoes. So,
as we say that the only thing tragedy gives us is the opportunity to rebuild our lives, and it starts with conversations, but most importantly campaigns like Close the Gap. And this is exactly why we're having this conversation, making sure that every single person feels seen, feels loved, but most importantly knows that help is there, man. If you've just tuned in, we want you to be part of this conversation. All you have to do is hit us up on our WhatsApp line on 061-862-1065. Now, of course, Natalie, coming back to, the ethos of this conversation, which is the importance of closing the gap, breaking the stigma, and also remembering the role that we as the community play. What role do you think should we play going forward in making sure that we educate but also support the work that you do?
So awareness campaigns and making sure that to support the community if they want to go back, if they were default clients, patients, to get them back onto treatment. Because it's very difficult, especially for people who is homeless, living on the street, to access services for treatment. And some of them are very scared because they know they actually stigmatize themselves. That self-stigma, and that is also very, it stops them from
actually getting those services.
And also that is, you can get your services at your nearby clinic. We have clinics that have very good relationships with Chapel Street Clinic, which is in Woodstock, and then District 6, as well as Lady Michaela's in Wynberg, in Plumstead, Wynberg. So, I mean, it is the staff are very friendly and they are very supportive in order to assist people who use drugs. So it's not all of society that is judgmentally. They are
those
that are compassionate and that have that empathy towards people who use drugs.
And that's exactly what we want. We want to grow that, and most importantly remind us that we too need to be the change that we see in the world, but it starts with the work that we need to do and also giving that grace. Now, of course, parting words to those that are listening, and most importantly, where do we find you if we want to follow the amazing work that you're still doing?
Okay, so we sampled as a website. So you can, all information you can access there. And the sampled offices are in Wynberg, in Constantia Main Road. And I do community, I engage with the community, so I'm all in the area.
You're everywhere.
So I do engage with them and just finding out what the challenges is, what the barriers is, and the most importantly, that is if there's an issue that arises, that then we advocate for that certain need for our PWUD community. So basically, that is in order for you to access services, you don't have to have your ID. You don't. If there was an address that was that you gave last, physical address that you gave last, it is to open up your folder. You can still use that address as well in order for you to access that services. And the services, you don't need to wait for an appointment. At work, it's done immediately. The only time when your results is given, and your results is a turnover of less than a week. So it's approximately 3 days that you will get the results back. So the people out there and our community, make sure it is that you go. Make sure that is that you know your status. Make sure that you are on treatment, and make sure it is that your viral load is suppressed, undetectable, untransmittable. Nothing about us without us. So you must be part of the decision-making process.
Thank you so much, Natalie. Thank you so much for allowing us to hold up the mirror to the work that we need to do. Like we always say, that we always want to be better humans, but it all starts with these conversations. It's uncomfortable. Sometimes it hits close to home, but I definitely know that there's someone who's listening right now and is definitely going to make a different decision because of the conversation that we had. So thank you so much for availing yourself.
You're welcome.
It is always such a pleasure. As we say, that it all starts with us, man. Alone we can do so little, but together we can do so much. Yeah. So all we say is that you can end it all.
So I'm just saying it is, if you can change one person's life, then
you've done it.
Then you've done it.
Oh, thank you for being that person to change our lives as well. So let us continue that all we need is just to remember that we need to love on each other.